Hi, my name is Dr. Hugh Wegwerth. I'm a functional medicine doctor in the Twin Cities, and I've been in practice for over 2 decades now. So today, what I want to go over is a functional medicine case on a digestive problem. And I just want to let you know, if you're out there suffering from any kind of digestive problem, Crohn's disease, diverticulitis, irritable bowel disease, whatever the disease is, diverticulitis, whatever the disease is that you're suffering with, I want to let you know I've literally helped hundreds and hundreds of men and women recover from their digestive system through a functional medicine approach. So that's what I'm going to cover today. Is I'm going to go over one of my patients. This is a 60-year-old male. I'm going to go over his intake. I'm going to go over his labs and go over his treatment program. So you can see here he's 60 years old. He comes in with inflammation, leaky gut, cold body. This has been going on here for 6 years, and it's been really bad. He was diagnosed in 2008 with diverticulitis. He's had 2 surgeries, hernia surgery, so he has a lot of scar tissue down in that area. He's gone to many different GI doctors. They did a biopsy. It comes back he's inflamed. Well, yeah, he knows he's inflamed. The GI doc wants to put him on antibiotics and hardcore medication. He's tried that. The next step is for him to get surgery and to take out parts of his colon that are really inflamed. It's affecting his quality of life. He's always bloated, always bloated. The flares have gotten worse. They would last 2 to 3 days. Now they're up to 6 weeks, up to 2 weeks. And he gets nasty bloating and he doesn't want to eat because he doesn't know what's going to happen, right? He has an episode and boom, next thing you know, he has to find a toilet. And if he doesn't know where a toilet is, he actually has an accident in his, he actually has an accident. This is another intake form that I have people fill out. This just goes over, the problems. Then what I like about this is it breaks this down into like organ systems. So this is your colon, right? So we just don't want to look at you from a colon standpoint. We want to look at you as a human being and what's going on with your entire body. So this goes from 0 to 3. So this gives us a good intake of what's going on with the rest of your organs, because everything's connected. It's just not about your digestive system. And then down here, I ask him things that he's tried, and he's doing a lot of things, right? He's trying probiotics, digestive enzymes, vitamin D with no avail. It's not helping him, right? Because he needs a specific custom tailored plan, and that's what functional medicine is all about. He goes to the GI doctors and gets an endoscopy, and you can see the entire colon was evaluated. And what did they come up with? Inflammation. Yeah, they already knew it was inflamed, diverticulosis, and how bad is it? Or how bad is it? It's severe, right? He's chronically inflamed. What's the protocol? What's the next step? Repeat in 5 years for polyps surveillance. Like, there's no answers for this guy. He doesn't know when he's going to have an episode. Here they recommend that he eats grains, whole grains. I'll go over the dangerous part of that when it comes to him. So this is some of the testing that we do. This is a food sensitivity testing. We check 96 different foods. How do we check that? It's through blood. It's a finger prick in office. So a lot of people are sensitive to foods, but they don't know that they're sensitive to them. Not like you eat something and you have a huge explosion. Some people that are like celiac disease, they eat gluten and they have a huge explosion. They're on the toilet. This test is checking for mild inflammatory sensitivities to food. So if you're eating, for example, 0 to 1 is normal. This is where you want to be. If you're eating these foods that are up in this area here, you're sensitive to those foods, causing your digestive system to be distressed, causing GI issues, causing your body to be inflamed, causing you not to absorb all the nutrients. So we check 96 different foods. So dairy's off the table. Yeast, which is in basically all sorts of bread products. Wheat, he's sensitive to wheat, rye, whole wheat. Now, if you look at this here, this wheat, what did they recommend? They just gave him a blank statement: eat whole wheat. Okay, eat this stuff because that's going to be good for your digestion. It's the fiber. Well, that's causing the problem. There's a lot of things that were causing the problem. Then we did blood work. And when you go to the doctor, you might have 1 or 2 vials of blood. I'm taking 14 vials of blood. People are saying, oh my goodness, has anyone passed out? No one's passed out, but a lot of sick people have gotten well, because the labs is like your fishing net. You throw the fishing net out, you reel in what you got, and then you go from there. Now, what I like about this graph here is it shows you markers that are non-optimal, right? So anything that's in white here is normal. That's where you want to be. Anything that's in yellow tells you that marker is trending towards a bad area. Anything that's in red tells you that marker is already bad. And anything that's in this alarm pink tells you that's a very bad state. So we get this back, and you can just look at all these yellows, right? There's problems there. There was never 14 vials of blood done, and they didn't look at this through a functional medicine approach. Like, what do these markers mean? Just not that you're going to die of like cancer or something. We want to know, what do they mean on a functional medicine basis? So you can just look at all this blood work. Here's 14 vials of blood, and he has lots of problems. Like, there's lots of yellows, lots of reds, and lots of hot pink. So what I like about this marker, or this program that I use, is, for example, this GGT right here, okay? I'm just going to go up and show you something. This GGT is elevated. Now, you see this range here? You see this optimal range? This is where we want you to be. So you can see this is 90. This falls in the optimal range. This is normal functioning, where normal human beings range from, okay? So then here, then this is the standard range right here. So you can see here that this person, for example, like right here is at 28. Well, we want this to be, is at 28. We want this to be less than 26, but this is the medical range, right? So functional medicine is looking at these ranges at a much narrower scope. Then right here, it tells you what this does. GGT, it has to do with pancreas, right? Eosinophils, which is white blood cell, has to do with intestinal parasites, digestive system problems, food sensitivities, homocysteine, not enough B12, not enough B6, you're not absorbing nutrients. If you have digestive problems, you're not going to absorb nutrients. Neutrophils, bacterial infection, where would the bacterial infection be? Well, that would be in his small intestine. Small intestinal bacterial overgrowth, MCV, B12, folate, vitamin C deficiency. So you can see here that we're looking at this, so we're diving in and figuring out what's going on. Vitamin D, chronic inflammation, chronic pain, depression, right? All those things that he was complaining about. Globulins right here, which is if you have enough hydrochloric acid in your stomach. I'll be talking about that in a second. Then the third test we do is this is a saliva test, right? This is a kit that you do at home. We check your hormones through saliva. We check it morning, noon, evening, and at night. And you want to have, this is your adrenal glands, which sit right above your kidneys. They're about an almond size in how big they are. We want you to be here. We want you to be in this dark green area. When we have Eric, you see how this is way abnormal here? That tells us that his cortisol levels are all over the map, destroying his digestive system. Like prednisone, have you ever taken prednisone? Like, that tears your digestive system up. That's a cortisol. That's cortisol levels, and you can see here cortisol levels, right? DHEA, which is a hormone, should be, here's is 28. It should be 137 to 336. So he's deficient in hormones. He doesn't have enough hormones in his body. So what did we do? What was his treatment plan? Avoid all foods that he's sensitive to. Do the hydrochloric acid challenge. This is basically to see if you have enough hydrochloric acid in your stomach. If you've had digestive problems since you can remember, in my clinical experience, you don't have enough hydrochloric acid. As we age, we don't produce enough hydrochloric acid. First thing I have anyone do that has a digestive problem is do this test. It's a simple test to do at home, and I'll have the whole video on it. We put them on vitamin D, 20,000 international units for a month, then 10,000 per day after that. Probiotics, 10 billion. L-glutamine, which is an amino acid, nutrition for your small intestine. We put them on trace minerals, a supplement called Homocystex Plus, which helps the digestive system. The hormone DHEA, we also put them on. We put them on L-glutamine, 25 grams per day. So he sipped this the whole day, mixed with water and sipped the whole day. I had him watch a couple of my videos on what homocysteine means and the pitfalls of going gluten-free. A lot of people go gluten-free, and that's a pitfall because gluten-free products are all sugar, and sugar can cause problems in and of themselves. Fish oil, I put him on 5 grams of fish oil per day, which is roughly a tablespoon. I also put him on this stuff called marshmallow root and slippery elm bark, which are natural anti-inflammatories for the intestinal system. You don't actually absorb these things in your small intestine. They smooth and decrease intestinal inflammation because we need to decrease that intestinal inflammation. So this is over about a 6-month, 7-month period here. He has few flare-ups. And the flare-ups that he had, they were self-induced because he ate something that he shouldn't to run off the supplements. Overall, he's 75% better. He's been suffering for this for over a decade. He comes to us and with six months, he's 70% better. Substantial reduction in inflammation. He's more active, less flares, not as long, not as severe, and not as constant. There are days where he feels normal, right? And he suffered for so many years. He would have weeks of flare-ups. He's taking the Cipro. We started addressing his adrenal glands. And I also put him on some other things, berberine and cat's claw, which is another digestive system support. But at the end of the day here, he got tremendously, I think we started around February. And then here is in October. And then I just saw him recently, and he's doing a lot better, 75% better. So if you're out there suffering, I let you know on digestive problems, you can get better. If you are not locally, I do telemedicine, which is basically over the internet on the phone. So if you don't live locally, you can still get better in my office. We can send you the testing kits. We can send you the supplements. All you need to do is click the link in this web page here saying that you want to come in and get an exam or a consultation. We can sit down how we can help you. Take care. I hope you found value in this.